Hi, you guys. So I'm re-recording this video because I didn't like how our recording turned out when we did the Zoom call. So to begin, today I'm going to be presenting about how to foam roll. So I'm going to be going over what is foam rolling and what are the benefits for it. And then I'm going to give a quick demonstration with the foam rollers that we have available in the gyms, or if you're looking for a different kind of foam roll, I'm also going to be presenting a little bit on other ones. If you do not know me, my name is Anai. I am a certified personal trainer, a student physical therapist, and I am the wellness assistant coordinator here with the city. So to begin, so what is foam rolling? Foam rolling is scientifically called a self-myofascial release technique, used a lot in a lot of athletes. And what that is, it's basically a self-massaging technique used in exercise treatment. It has the same results as stretching, as it relieves muscle soreness, inflammation, and increased joint range of motion. And it's great for those who exercise every day. So if you're not somebody who likes to stretch, foam rolling is a great alternative, although you should be creating those healthy habits of stretching every day. So the whole point of foam rolling is you want to focus on large muscle groups. The ones that we're going to touch on today is the thoracic back, which is like the big back muscle, your lats, some glutes, hamstrings, your IT band, which is a forgotten muscle that people don't usually stretch, but it's an important muscle. And then the basic quads, calves, tibia, and you can even foam roll your feet. As you can see here in the pictures on the right, you can see that there's a bunch of different foam rolls depending on what you're looking for and what you want in the foam roll. Again, it's self-massaging. So basically you're rolling yourself on these foam rolls to give your muscle that relaxation, the same thing as stretching. The biggest thing with foam rolling that you want to look out for is you're just targeting the muscle groups. So you don't want to be foam rolling on any like bony prominences over joints, because that can cause a lot of inflammation on the joints if you're overdoing it. So going back to how you can foam roll different parts, as you can see, there's different sizes depending on what you want to foam roll. For the feet, that little um, the massage ball is great to step on. I do it with a tennis ball. I even do it with a water bottle. As you can see, there's other different variety diameters, is really cool. And another thing that I want to mention for foam rolling is you always want to foam roll for at least 30 to 60 seconds. Remember last time in our last talk with the stretch lab, I talked about how 30 seconds is a really important number in terms of unwinding the muscle, because that's just enough time for the body and the brain to recognize that, oh, I'm trying to unwind my muscle right now. So making sure we hold that for 30 seconds to create permanent changes. The only reason why I emphasize that a lot is because I get a lot of people who tell me, oh, I stretch every day. But like my flexibility isn't getting better. And that's probably because, we're not holding it long enough. We need to hold it just enough to make sure we get those permanent changes. So moving on to the benefits, other benefits of foam rolling. I already went over this with the stretch lab, but it has the same effect. So it decreases stiffness and increases range of motion. It trains the muscle to reduce risk of injury. It improves soreness, improves posture. It reduces muscle tension and stress. It promotes circulation, which is a big thing when it comes to muscle rehab and making sure we're incorporating this into our treatment, because it's important if you're someone who is just trying to work out every day. You want to take care of your body through this. And it also decreases the risk of low back pain. So it's really good for the back too. And it's something that I do every day and found that it's really good for my back. Okay, so going into the demonstration, so I am going to stop sharing so that you can see me. So you should be able to see me. And I'm going to take you guys over here on the ground so that I can do the demonstration for foam rolling. Excuse me. Okay, so I'm going to kind of have you guys down here. But as you can see, we have two foam rolls here. Um, so these are the two standard foam rolls that we have in the gym. This one is a much firmer, deep massage foam roll. And then this one will give you um, a less intense massage. So this one is great for beginners. This one is for people who need deep tissue, a knot that's really deep in there. And it's a lot more intense. So I always recommend for beginners to use this one first. They come in different sizes. So if you're someone who enjoys doing this, once you try it out in the gyms, You don't have to get a full size. This is a 36-inch by 3-inch diameter. So they come in different diameters. 3 inch is standard and 36-inch is the full one. But you can get different sizes. As you can see here, this is a 1/3 of this. I think this is a 13-inch one, or they even come in halves, and these are great for storing underneath your desk. And you can do a lot with this too. So going into the demonstration. So like I said, the foam roll is like a rolling pin. The first things that we're going to work on is I'm just going to kind of go up body and then go down low. For the arms and for the arms, we don't really need to use a big foam roll for this. You can just kind of use a water bottle and go on your desk and kind of foam roll it yourself. I'm going to be demonstrating the back. So for the back, you might hear some popping, and that is completely normal. It should not be painful. If it is painful, I recommend to like just stop right away, and don't continue. Talk to your doctor about that. But popping is completely normal. You might hear some popping on me. So with the foam roll, what you always want to do and what I recommend for people is always start with the foam roll in the middle of the muscle. Because when you're rolling up and down, you just want to make sure it gets an even across all. If you start too low or too high, it might be going over those bony prominences that I said remember to avoid. So for the back, I'm kind of just going to make sure my foam roll is close to me, kind of tucked in with my elbows. I'm going to put my hands behind my head, just making sure you guys can see me, and then just making sure my feet are close enough to me. If they're too far, I can't lift myself up. So getting close, picking up my bottom and just rolling up and down. Oh, yep. And just kind of bringing that back and forth. So I'm already hearing some popping, which feels really, really nice actually. It's kind of similar to how chiropractors pop your neck. It's really good. Or not your neck, I'm sorry, your back. So that's how you stretch the mid thoracic, or foam roll the mid thoracic. Now we're going to go into the lats. For the lats, you just kind of side bend to the side, bring your arm up, and go all the way up and down. So as you can see, I'm always going to be lifting up my bottom and just going back and forth, which is nice. So moving on to the glutes. The glutes are really nice. It feels really good, especially after a leg day. I'm already sore because I had leg day today, but you kind of just want to go over to the side, just avoiding your sacrum, which is your tailbone. You don't want to go over your tailbone. And again, it's just going over. And if you want a much deeper, intense, you can do that piriformis stretch, which stretches it a little bit, and go over that muscle for a more intense, deeper one. And that feels really good. Okay, so moving on to quads and hamstrings. Hamstrings, remember putting it in the middle of where you want to start and just evenly rolling up and down. So you can do both legs. I'm doing both legs right now. You can do one leg at a time. So you can just kind of push it over to help yourself if you need a little bit more support. Just kind of go up and down and just making sure your feet is close enough to you. If you have it too far, I'm not going to get enough leverage. So making sure it's up and I can go over. Same thing with calves. Just bring it down. You can see it's right in the middle of my leg and just go up and down again. And what I like to do too, and what I tell people is roll in and out too. So you see that my toe is pointing in like that and out to get the full leg muscles, because it feels really nice and you might be missing some sore spots and knots. So I'm gonna go into quads. So quads might be self-explanatory. You can kind of just, I'm gonna do one at a time to just show you guys. So you can kind of just go up and down, resting this knee, because sometimes lifting up both legs is a lot of energy. So up and down, or you can do both and just go up and down. See, I'm pushing against my toes and just kind of rolling myself. It's a nice massage. Another one that I wanted to show you guys that you probably aren't familiar with, that we give a lot to the people in the clinics, because if you have any hip or knee problems, especially knee problems, this is a big muscle that people forget to stretch. And foam rolling it too helps a lot with the pain in there, because there's a lot of tightness that is caused right here. And you can see it a lot with people who have weakness in their legs. So it's the IT band, which is connected on the side of your leg. And what I have people do for this one is, again, put it on the side. So this leg, the one that's not getting rolled, is going to come over, and you're going to kind of kick this one straight like that. So do you see my arm is down on the floor? You can also use this arm to just kind of give yourself support. So do you see that this is too high? It's on my hips. So I'm going to lower it down a little bit. Make sure you get in the middle and just roll up and down. And make sure, oh, that one's sore for me. You're getting the full on muscle. And this one's really, really good for anyone who has tight hips, tight knees, weakness. So you want to make sure you're also getting this muscle. It's an important muscle. Okay, so I think that's it for the demonstration. Let me see if I think I have one more slide for you guys. So I'm going to go back to screen sharing. And so the wrap up, if you guys have any questions, you guys can email me or email wellness. I will also get those emails. I did have a foam roll exercise sheet that I gave to you guys during the presentation, and I'll make sure to link it in the YouTube video. I also have a foam roll Amazon list for any foam rolls, or at least the standard ones that we have here in the gym if you'd like to purchase one. They're inexpensive. They're at least $20, I think, at the most, which I think is great because health and longevity, it's worth it, you know? And then the Pro Club sign-in sheet, if you were here during the Zoom, you should have already gotten it. Again, thank you guys so much for listening, and I hope you got something out of this presentation.